1. A nurse is assessing a 3-year-old child with a history of asthma who presents with nasal flaring, intercostal retractions, and diminished breath sounds. What is the nurse's priority intervention? Answer: administer a prescribed short-acting beta agonist, albuterol, via nebulizer. Rationale: the child is exhibiting signs of severe respiratory distress, requiring immediate bronchodilation to improve airflow. Diminished breath sounds indicate worsening airway obstruction, and rapid intervention is necessary to prevent respiratory failure. 2. A pediatric nurse is caring for a 6-month-old infant admitted with severe dehydration. The child has sunken fontanelles, lethargy, and poor skin turgor. What is the priority nursing action? Answer: initiate IV fluid resuscitation as prescribed. Rationale: severe dehydration can lead to hypovolemic shock in infants, and IV fluids restore circulatory volume more rapidly than oral rehydration therapy. Delayed intervention increases the risk of organ failure. 3. A 10-year-old child with sickle cell anemia is admitted with vaso-occlusive crisis. What is the most appropriate nursing intervention? Answer: administer prescribed IV fluids and pain medications. Rationale: hydration helps reduce sickling and improve circulation, while opioid analgesics like morphine manage severe pain. Oxygen therapy is only necessary if hypoxia is present. 4. A nurse is teaching the parents of a child with cystic fibrosis about pancreatic enzyme replacement therapy. When should the enzymes be administered? Answer: administer pancreatic enzymes with all meals and snacks. Rationale: pancreatic enzymes aid digestion by replacing the missing enzymes in cystic fibrosis, ensuring proper nutrient absorption. They must be given before eating for optimal effectiveness. 5. A child with Kawasaki disease is receiving IV immunoglobulin, IVIG therapy. What is the most important nursing assessment? Answer: monitor for signs of an allergic reaction and assess cardiac function. Rationale: IVIG can cause anaphylaxis, requiring close monitoring. Kawasaki disease can lead to coronary artery aneurysms, making cardiac assessment essential. 6. A nurse is prioritizing care for 4 pediatric patients. Which patient should be assessed first? Answer: a 2-year-old with croup and inspiratory stridor at rest. Rationale: inspiratory stridor at rest indicates airway obstruction, which can rapidly progress to respiratory failure. This patient requires immediate intervention. 7. A school nurse is assessing a child who suddenly develops difficulty breathing and facial swelling after eating peanut butter. What is the immediate intervention? Answer: administer intramuscular epinephrine as prescribed. Rationale: anaphylaxis is a life-threatening emergency requiring immediate epinephrine administration to reverse airway obstruction and circulatory collapse. Delaying treatment increases the risk of death. 8. A nurse is providing care for an infant with bronchiolitis caused by respiratory syncytial virus, RSV. What is the most appropriate nursing intervention? Answer: provide supportive care, including nasal suctioning, hydration, and oxygen therapy if needed. Rationale: RSV is a viral infection, and treatment focuses on symptom management. Antibiotics are not indicated unless there is a secondary bacterial infection. 9. A 7-year-old child with type 1 diabetes is found unresponsive with deep, rapid breathing and a fruity odor to the breath. What is the nurse's priority intervention? Answer: administer IV insulin and fluids as prescribed. Rationale: the child is experiencing diabetic ketoacidosis, DKA, requiring immediate insulin to correct hyperglycemia and IV fluids to address dehydration and electrolyte imbalances. 10. A nurse is educating parents about sudden infant death syndrome, suicides prevention. What is the most important instruction? Answer: place the infant on their back to sleep in a crib with a firm mattress. Rationale: supine positioning reduces the risk of SIDS by preventing airway obstruction and rebreathing of carbon dioxide. Soft bedding and co-sleeping increase the risk. 11th, a nurse is caring for a 5-year-old child with newly diagnosed leukemia receiving chemotherapy. What is the most important infection prevention measure? Answer: implement strict hand hygiene and place the child in protective isolation if necessary. Rationale: chemotherapy-induced neutropenia increases infection risk. Hand hygiene is the most effective way to prevent infections in immunocompromised patients. 12th, a nurse is assessing a child with increased intracranial pressure, ICP, due to a traumatic brain injury. Which finding requires immediate intervention? Answer: fixed and dilated pupils. Rationale: fixed and dilated pupils indicate brainstem herniation, a medical emergency requiring immediate intervention to prevent brain death. 13. A nurse is caring for an infant diagnosed with developmental dysplasia of the hip, DDH. What intervention should be included in the care plan? Answer: maintain the infant in a Pavlik harness as prescribed. Rationale: the Pavlik harness keeps the hips in flexion and abduction, promoting proper joint development and preventing long-term disability. 14. A nurse is evaluating a child with suspected acute epiglottitis. What action should be avoided? Answer: avoid examining the throat with a tongue depressor. Rationale: throat examination can trigger laryngospasm, leading to complete airway obstruction. Emergency airway management must be prepared before any examination. 15. A child with a ventriculoperitoneal (VP) shunt for hydrocephalus presents with irritability, vomiting, and a bulging fontanelle. What is the nurse's priority action? Answer: notify the healthcare provider immediately. Rationale: these symptoms indicate increased ICP due to shunt malfunction, requiring urgent intervention to prevent neurological deterioration. 16. A nurse is teaching parents of a child with a newly placed gastrostomy tube (G-tube). What is an important discharge instruction? Answer: clean the site daily with mild soap and water and monitor for signs of infection. Rationale: proper hygiene prevents infection and promotes healing. Redness, swelling, or discharge should be reported to the provider. 17th, a child with acute gastroenteritis has persistent vomiting and diarrhea. What is the best fluid replacement strategy? Answer: administer oral rehydration solution (ORS) in small frequent sips. Rationale: ORS helps replace lost fluids and electrolytes without worsening vomiting. IV fluids are reserved for severe dehydration. 18. A nurse is assessing a 4-year-old child with suspected autism spectrum disorder, ASD. What finding supports the diagnosis? Answer: lack of eye contact and delayed speech development. Rationale: impaired social interaction, communication delays, and repetitive behaviors are hallmark signs of ASD. Early diagnosis allows for early intervention. 19. A nurse is delegating tasks to an unlicensed assistive personnel, UAP, in a pediatric unit. Which task is appropriate to delegate? Answer: assisting a stable child with ambulation. Rationale: UAPs can assist with activities of daily living, ADLs, and mobility for stable patients but cannot perform assessments or administer medications. 20%. A nurse is caring for a child with a full-thickness burn covering 20% of the body. What is the priority nursing intervention? Answer: initiate fluid resuscitation as prescribed. Rationale: large burns cause massive fluid shifts, leading to hypovolemic shock. Early fluid resuscitation prevents circulatory collapse and improves outcomes. 21st. A nurse is assessing a 6-year-old child with acute glomerulonephritis. Which finding requires immediate intervention? Answer: signs of pulmonary edema, such as dyspnea and crackles. Rationale: acute glomerulonephritis can lead to fluid overload and pulmonary edema, requiring urgent diuretic therapy and respiratory support to prevent respiratory failure. 22nd. A child is diagnosed with meningococcal meningitis. What is the nurse's priority action upon admission? Answer: implement droplet precautions immediately. Rationale: meningococcal meningitis is highly contagious and requires droplet precautions to prevent transmission. Early isolation protects healthcare workers and other patients. 23rd. A 9-year-old child with juvenile idiopathic arthritis, JIA, is experiencing morning stiffness. What intervention should the nurse recommend to the parents? Answer: encourage the child to take a warm bath before activity. Rationale: warm water helps loosen stiff joints and improve mobility, reducing discomfort associated with JIA. 24. A nurse is caring for a toddler with a tracheostomy following an airway obstruction. What is the priority action if the tracheostomy tube becomes dislodged? Answer: attempt to replace the tracheostomy tube with a spare one of the same size. Rationale: immediate reinsertion restores the airway and prevents respiratory arrest. If reinsertion fails, emergency measures like bag mask ventilation may be necessary. 25. A child with hemophilia A presents with joint swelling and pain after a minor fall. What is the nurse's priority action? Answer: administer recombinant factor VIII as prescribed. Rationale: hemophilia A results in deficient clotting factor VIII, and administration prevents further bleeding into the joint, reducing pain and long-term damage. 26. A nurse is teaching parents of an infant with gastroesophageal reflux, GER. What instruction should be given to reduce symptoms? Answer: feed the infant in an upright position and keep them elevated after feedings. Rationale: maintaining an upright position prevents reflux of gastric contents into the esophagus, reducing discomfort and aspiration risk. 27. A nurse is caring for a child with suspected intussusception. What clinical finding supports this diagnosis? Answer: episodes of severe colicky abdominal pain with red, currant, jelly-like stools. Rationale: intussusception causes telescoping of the intestines, leading to obstruction and bleeding, which manifests as characteristic stools. Prompt intervention is needed to prevent ischemia. 28. A child with suspected acute appendicitis reports sudden relief of severe abdominal pain. What is the nurse's priority action? Answer: notify the healthcare provider immediately. Rationale: sudden pain relief in appendicitis may indicate rupture, increasing the risk of peritonitis. Immediate intervention is necessary to prevent sepsis. 29th. A nurse is providing education to the parents of a child newly diagnosed with celiac disease. What dietary instructions should be given? Answer: avoid all foods containing gluten, such as wheat, barley, and rye. Rationale: gluten triggers an immune response in celiac disease, leading to intestinal damage and malabsorption. A strict gluten-free diet prevents symptoms and complications. 30. A 2-month-old infant presents with projectile vomiting, weight loss, and dehydration. What is the most likely diagnosis? Answer: pyloric stenosis. Rationale: pyloric stenosis causes hypertrophy of the pyloric muscle, leading to gastric outlet obstruction. Projectile vomiting and dehydration are classic signs requiring surgical intervention. 31. A nurse is caring for a child with a suspected Wilms tumor. What is the most important precaution? Answer: avoid palpating the abdomen. Rationale: Wilms tumor is highly vascular, and palpation may cause tumor rupture, increasing the risk of metastasis. Careful handling is essential. 32nd. A nurse is assessing a 5-year-old child with a cyanotic congenital heart defect. What is a priority nursing intervention during a hypercyanotic DRTT spell? Answer: place the child in a knee-chest position. Rationale: the knee-chest position increases systemic vascular resistance, reducing right-to-left shunting and improving oxygenation. 33rd. A nurse is caring for a child with a suspected foreign body aspiration. What assessment finding is most concerning? Answer: absence of breath sounds on one side. Rationale: unilateral absence of breath sounds suggests complete airway obstruction, requiring emergency intervention, such as bronchoscopy to remove the foreign object. 34th. A nurse is educating the parents of a child with impetigo. What is the most important instruction? Answer: keep the child's nails short and wash hands frequently. Rationale: impetigo is highly contagious and spreads through direct contact. Short nails prevent scratching and further skin breakdown. 35. A nurse is reviewing laboratory results for a child receiving chemotherapy. Which finding requires immediate intervention? Answer: absolute neutrophil count, ANC, less than 500 cells per cubic millimeter. Rationale: severe neutropenia increases the risk of life-threatening infections, requiring protective isolation and prompt treatment. 36. A nurse is assessing a child with Duchenne muscular dystrophy. What is an expected early sign of this condition? Answer: difficulty rising from a sitting or lying position, Gower's sign. Rationale: Duchenne muscular dystrophy causes progressive muscle weakness, and children use their hands to push themselves up due to proximal muscle weakness. 37. A child is admitted with diabetic ketoacidosis, DKA. What laboratory results should the nurse monitor closely? Answer: serum potassium levels. Rationale: potassium shifts occur with insulin therapy, leading to potential hypokalemia, which can cause life-threatening cardiac arrhythmias. 38. A nurse is preparing to administer an intramuscular IM injection to a 12-month-old infant. What is the preferred site? Answer: vastus lateralis muscle. Rationale: the vastus lateralis is the safest site for IM injections in infants due to its muscle mass and lack of major nerves or blood vessels. The deltoid is not suitable for large volumes in this age group. 39th. A nurse is caring for a child with infectious mononucleosis. What activity restrictions should be emphasized? Answer: avoid contact sports until cleared by a provider. Rationale: infectious mononucleosis can cause splenomegaly, increasing the risk of splenic rupture with trauma. Avoiding contact sports prevents life-threatening complications. 40. A nurse is assessing a 3-year-old child who has just ingested an unknown amount of acetaminophen. What is the priority nursing intervention? Answer: obtain an acetaminophen serum level and prepare to administer N-acetylcysteine as prescribed. Rationale: acetaminophen overdose can cause fatal liver damage. Early administration of N-acetylcysteine prevents hepatotoxicity.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!